incision wounds from the implant surgery usually heal quickly and without complications if simple precautions are taken.
Cooperation with your oral surgeon is very important.
Here are some guidelines and instructions for you to follow to aid in your healing and recovery.
Rest at home, keep quiet, and generally take it easy for the first 24 to 48 hours following surgery.
It may not be necessary to go to bed, however, it is important that you rest.
If you had general anesthesia or IV sedation, you may experience lightheadedness, dizziness, and sleepiness following surgery. It is advisable not to stay alone.
A responsible adult should stay with you for 12 hours after surgery.
We know that you are eager to see the surgery that has been performed.
However, please do not forcefully pull your lips or cheeks away to inspect the surgical sites.
These actions could tear your sutures or delay healing.
The mouth may be gently rinsed with a warm saltwater solution starting around 2 hours after your surgery.
This rinsing should be done frequently, especially after meals and before bedtime for 1 week.
You can also drink moderate amounts of liquids such as soda, water, milk, and juice.
Please do not smoke for 24 hours. Smoking may dry out the tissues and delay healing.
Smoking can also cause you to bleed more and for longer periods of time.
Swelling is to be expected.
Place an ice pack on the affected area immediately upon return home. 15 minutes on, 5 minutes off. Do this for the remainder of the day.
Swelling usually reaches its maximum within the first 48 hours and then slowly decreases.
The application of warm, moist compresses after 48 hours will promote rapid reduction of swelling.
Bruising sometimes occurs after implant surgery.
It is a natural result of the drilling involved to place the implants, and you should not be alarmed if it occurs.
The bruising often shows up a few days post-surgical and may be located either above or below the area that the implants were placed.
No straws, please.
It is most important that you maintain a nutritious diet during the weeks of healing.
The patient who maintains a good diet or soft food generally feels better, has less discomfort, and heals faster.
Since you will be taking medication, it is important that you eat to prevent nausea.
Here are some foods we recommend.
Soups,
Milk or hot chocolate,
Yogurt,
oatmeal or cream of wheat,
Ice cream,
soft-boiled or scrambled eggs,
milkshakes,
broiled fish or stewed chicken,
applesauce,
potatoes baked or mashed,
pudding,
cottage cheese,
Jell-O,
peas, asparagus,
carrots.
or any soft cooked vegetables.
Consult with your surgeon if you are currently wearing a full or partial denture or a single tooth prosthesis called a flipper to determine if you may begin wearing the appliance again.
Have prescriptions filled promptly and take as directed by your doctor.
Non-narcotic medications such as Motrin, Advil, ibuprofen, or Tylenol should be taken as soon as possible and repeated as prescribed for the first several days.
Narcotic pain medications can be taken as directed by the doctor in addition if pain relief is not adequate.
However, when narcotic pain medications are taken, you should not operate automobiles or other power equipment.
Antibiotics, when prescribed, should be taken as directed until they're completely gone.
If a rash or swelling develops, discontinue the antibiotic immediately and call the office to inform your doctor.
We are concerned about your well-being.
If you should experience any difficulty in breathing, bleeding that you feel is excessive, persistent nausea, or vomiting, any pain that is unusual, please call us at any time.
There's always a doctor on call to answer your questions or provide you with emergency care.